Congratulations, your cast is finally off. But then you look at your arm or leg and get shocked. Why is the color dark or bluish? Why is it still swollen? And why does the joint feel completely stiff, like it forgot how to move? Here's the truth most patients don't realize. Removing the cast is not the end of treatment. It's actually the beginning of recovery. And the first 48 hours after cast removal are critical. If you handle them correctly, you can restore movement faster and avoid long-term stiffness. If you ignore them, you might struggle for weeks. In today's video, I'll give you 5 essential steps you must start immediately at home to safely reduce swelling and regain mobility. Stay with me carefully. Every step matters. Getting a cast removed. Step 1. Skin care and gentle cleaning. After weeks inside a cast, your skin goes through several changes. Dead skin builds up, causing peeling. Reduced blood flow leads to darker or bluish color. Sweat and trapped moisture affect skin texture. What should you do? Wash the area with lukewarm water and mild soap. Gently clean without scrubbing aggressively. Pat dry carefully. Don't rub hard. Important warning: do not scratch or peel the skin forcefully. This can cause skin injury or infection, especially since the skin is fragile at this stage. Step 2. Elevation, your first weapon against swelling. After immobilization, your muscles are weak and circulation is slower. So when you stand or sit, gravity causes fluid to accumulate, leading to swelling. Solution: elevation. Raise the affected limb above heart level. Use pillows while lying down. Maintain elevation for 30 to 60 minutes, 3 to 5 times daily. This helps improve venous return, reduce swelling faster, and relieve discomfort. Step 3. Contrast bath, warm and cold therapy. This is one of the most effective techniques patients ask about. How does it work? Warm water dilates blood vessels. Cold water constricts blood vessels. This alternating effect improves circulation and reduces swelling. How to apply it? 3 minutes in warm water, 1 minute in cold water. Repeat cycle 3 to 5 times. Make sure water is not too hot or too cold. No open wounds before doing this. Step 4. Gentle exercises, muscle activation. Your muscles have weakened due to inactivity and joints have become stiff, so start with very simple movements, such as opening and closing fingers, moving the ankle up and down, gentle circular joint movements within pain-free range. Key rule: mild discomfort is normal. Sharp or severe pain means stop immediately. These exercises help restore mobility, improve blood circulation, and prevent long-term stiffness. Step 5. When should you be concerned? To keep things medically safe, you must recognize warning signs. Contact your doctor immediately if you notice severe, unbearable pain, excessive or worsening swelling, intense bluish or black discoloration, unusual warmth or redness, possible infection, inability to move the limb at all. These symptoms may indicate complications that need urgent evaluation. Conclusion. Let's quickly recap. Number 1, gentle skin care. Number 2, elevation to reduce swelling. Number 3, contrast bath for circulation. Number 4, simple exercises to restore movement. Number 5, watch for warning signs. If you follow these steps correctly, you'll significantly speed up your recovery. Now, tell me in the comments, how long was your cast on, and have you started these steps yet?